And that's exactly what happened. Now they're saying that when they look at the DNA strands of the virus, they're showing similarities to bats. But they're also showing similarities to several other animals as well. So again, part of the reason why we don't have a vaccine yet is because we still don't know the exact origin of the virus itself. We have components of the virus within the DNA structure and sequencing, but we do not have the specific viral code or DNA RNA code. Therefore, we can't produce a vaccine. Okay?
One of my other questions, I don't know, do you have anything to add to that, Jessica?
No, I pretty much have looked at research on similar lines and looking at it's definitely crossed over from animals, and that's where when I talked with students about the livestock and all the problems that come from livestock with all our chickens, you know, being where they can't even move and they're stuck and they're right near cows and, you know, everything else, and mixing all these animals isn't good for them or for the environment or our own health. And so especially in these wet markets that they have in China, where they have all kinds of animal remains together and they're mixing the blood and everything. When she was talking about a wet market, that's what we're referring to, is where they have all these dead animals they're selling, and they've seen other times that viruses have jumped from the animals to humans.
Yeah.
So I think it has to do with us just having better practices towards animals and better health in general for ourselves.
You're saying that's the way to prevent other diseases coming, like moving forward?
No, I think we need to look at our practices. I'm not saying that we can totally prevent anything. I think that we've just seen it sometimes, or what we're looking at, the origins for some of them that we found have been these wet markets.
Okay.
So I think in general, when we talked about extinction rates, I guess that's where I mentioned things, especially over in China where they're selling endangered species and things. I think in general, for a lot of reasons, those markets need to be examined and their practices. I don't necessarily think we can slow down the evolution of bacteria or viruses, because we've greatly caused those to speed up with other practices. So I do think we need to be careful, but I don't think we can, scientists will never be able to work as fast as a virus or a bacteria can evolve.
Okay. So you mentioned that if we catch it again, like how is it affect the body? It impacts the lungs. We know that, connected to as far as SARS. Can you repeat that if you said it? So what it will attack in our bodies?
So we're seeing a very broad range of syndromes, if you will, within the body, this is a bit more uncharacteristic than other viruses that we've had in the past, because the range of symptoms is so broad. So you have the normal, let me just get back into my notes. You have the symptoms of the fever, the cough, the chest congestion, the fatigue, headache, backache, diarrhea, the shortness of breath. So all of the respiratory things, some people have them, some people, they're worse in some people than in others. Those are some of the normal symptoms, if you will. Some of the other things that are even more concerning are that we're seeing blood clots all throughout the body. And so the danger of having blood clots obviously is twofold, because if you're having an emboli, and an emboli is a clot in the lungs, okay? That's what we call an emboli. It is a blood clot. It's just another name and where it's located. We're seeing clots in the lungs. We're seeing clots in normally healthy patients. So this is why, you know, originally, when this virus first came out, we anticipated originally that it was going to hit our elderly population the hardest, because they would most likely be the ones who had weakened immune systems. And ironically, what we're seeing is that that is not at all what happened, that it actually hit the age ranges from between like late 40s into the early 60s the hardest. That's a very, very large population of people. But it's hit all categories, but that particular category has been hit the worst, along with the fact that African American, Black African American, and Hispanic have also been hit the hardest with this virus. And we're not exactly sure why that is. But some of the symptoms that we're seeing are these blood clots, which so the clotting is actually, so it's associated with the immune system. It's an immunoresponse. It's an inflammatory response. When you see clots, that means that there's an inflammation occurring inside the body, in particular inside all of the blood vessels of the body. So every vital organ in your body is supplied by these blood vessels. Mm-hmm. And what's happening is we're seeing blood clots throughout these vessels. And because of that, it's an inflammatory response to the body trying to fight off the virus. It's creating these blood clots. And because these blood clots are in so many of the vessels, that's what's leading to total organ failure, your kidneys, your lungs, your heart. So we're seeing vital organ shutdown with this virus, so yeah, so this is, and these, by the way, so I've interviewed people, I have friends who are young, healthy, in their 30s, the epitome of health, clean eating, nothing wrong with them, who have had this virus. In fact, a friend of mine in Pittsburgh, she's 35 years old, the epitome of health. And she exercises every day, she eats clean. She is on day 59 of this virus, and she's been in the hospital 3 different times. She now has pulmonary complications because of the virus that we don't even know. This is ongoing now. So normal, healthy, young people are being affected and are dying from this virus. People the naysayers are like, oh no, this is hype. No, it's not hype, it's real, and it's happening.